I'm Kerry Fink with Helping Seniors of Brevard, and it's time for Helping Seniors Updates. And today is Friday. It's the 1st of May. Can you believe we've completed the 30 days that they asked us to do about slowing the spread? I guess that was beginning at the 1st of April. And so here we are as we do these updates every Monday, Wednesday, Friday to keep you up to date on all the things that are going on throughout Brevard County as it pertains to COVID-19 protection and staying safe. So we hope you've had a safe week and a good week. And I have the privilege today on Helping Seniors Update of having with me Dr. Kevin Kilday. Dr. Kevin runs the holistic health centers here along the Space Coast and is a frequent contributor both in the Helping Seniors newsletter. You'll see his columns there, but you'll also find him from time to time in Spotlight Magazine and a number of other resources throughout the county. He's a sought-after expert about holistic health. And Dr. Kevin Kilday, it's a pleasure to have you here on Helping Seniors Update today. How are you doing?
I'm doing very good. It's a pleasure to be here.
You know, we just finished up doing radio on Wednesday of this week. In fact, there's a great radio show where we're talking about a lot of topics relevant to surviving effectively and doing well through this COVID-19 crisis. You can find that radio show, by the way, on the Helping Seniors website at helpingseniors.brevard.org, helpingseniors.brevard.org, or on our Helping Seniors YouTube page. And I think it was good information that you had for us there, Dr. Kevin. But I wanted to ask you, if somebody has not heard that particular radio show, you were talking a lot about ways to get through the COVID-19 time, and you were focused on spirit, soul, and body. And I was going to get you to ask just a little bit about how you're helping people at this time with those questions.
Well, I do, nutritional consulting as well as, spiritual consulting. I have a degree in pastoral counseling. So I'm able to, help people spiritually, with, any mental health issues and, just to help people in general, with their nutrition and, anything that might have come up that they're not, don't usually have as a result of, being in the house for, for a whole month or 6 weeks. And, and also, if you have already some diagnosed issues, this the stress of this thing alone, can present some, some more, problems, may it be, mind, body, or spirit. So, so I'm able to help in all those areas.
You know, we were talking about this on the radio show on Wednesday, that you had mentioned that particularly as people are home and is sort of perceived as they're being stuck at home, that a lot of challenges, you're seeing a lot of challenges with both a depression, and then some people are kind of self-medicating. I know we were sort of half joking that they considered the liquor stores an essential business in Florida. And so those guys are doing a brisk business, but if it gets out of hand, you're also an expert on addictions and recovery and those part of things too.
Yes, and unfortunately, I believe that a lot of the meetings, support meetings that people with addictions go to, I believe that they are very limited. Also, it all depends on what location they're at and the rules. A lot of times they meet in churches. So it really depends on the rules of the church that they're in. But people with with addictions, they really need that support arm, of AA meetings or NA meetings. And I've heard that they're having a hard time finding some.
So, as a question about that, then, what advice do you have for people that are moving through this? I know it's uncharted territory for all of us, but from your perspective, what do you suggest people, or how do you suggest people take care of themselves throughout all of this?
Well, I mean, being in the inside a lot that, and you're not used to it. For instance, if you have a job that that you were just furloughed at, and
Mhm.
all of a sudden, and you've been with them for years, and all of a sudden you're home, and uh, so a lot of people just may get in the habit of just sitting around and catching up on their shows on TV and things like that. That is not a very good thing to do. Uh, some of the things that that could be done is to prioritize your time. Even if like you would do at work, on any particular job, you really have to prioritize
Mhm.
your day's work. So it's good to stay in that habit and prioritize your day when you're at home, and to organize your time. Even sit down with a pad and say, well, between 10 and 11, I'm going to do this. I'm going to try to accomplish this. And there's also, if you're a homeowner, it could be a lot of projects that that you could be catching up on. But
Mhm.
if you're not used to doing that type of work, you just need to pace yourself really in anything that any project that you may take on. And it also was very important too is is also eating correctly. To try to stay away from all the snack foods when you have a lot of idle time. You just continue to whatever your healthy type of eating that you were doing in the past. Just continue to do that. And it's very important also to get the ample sleep,
Mhm.
because during these stressful times, and doing things out of your norm, um, it just plays havoc, on your body and mind and spirit. But as far as the body goes, it's just good to get ample amount of sleep, to continue to get your 7 or 8 hours, however amount of time that you normally get. And because it rejuvenates the body, and your body heals as you're sleeping.
Mhm.
So
Mhm.
so that's very important. I mean, it wouldn't be very good to to be staying up late hours and drinking all the time. That could present some real problems in the future. And also it's good to go outside, uh, just to get, just out of the house. I'm not saying to go out shopping or anything, and be safe if you're going to be around people, to, to follow the guidelines and wear a mask. But it's just good to, just to get yourself outside, and just go for a walk,
Uh-huh.
because exercise also increases your serotonin level in your brain, and exercise makes you actually feel good. And we're lucky down here in Florida is having a lot of sunshine on a lot of days, and try to pick a day where the sun is out, because
Right.
just walking outside for 10 or 20 minutes, you're actually getting more than ample of vitamin D, just from the sun.
Mhm.
And vitamin D has been thoroughly studied, and it's they even say this, that maybe take some vitamin D supplements, during this time, because it helps with the immune system, and it's a great antiviral, also.
Mhm.
So just walking outside
Is a good
would give you, a lot of vitamin D, if you're walking out in the sun.
so
So,
it's a good
so you get the vitamin D and you get the exercise. So, it's good all the way around.
it sounds like it. And we're getting toward the end of staying at home and getting into sort of a new normal as things kind of reopen. And I wanted to ask you, how are you helping people? Obviously, in this day and age of social distancing, I assume you are staying busy and working with people and helping them. But obviously, the face to face visit idea isn't really the thing that's happening right now, right?
Right, but I, I see a lot of clients up in Melbourne at an office building called the 1900
Uh-huh.
building. So I am able to see clients, in that building. but I do have a requirement that they and the office spaces that I use, are very large, so they
Uh-huh.
can sit 6 feet away from me,
Right.
for a consultation, and I do require that they wear a mask if they come and
Uh-huh.
see me,
Uh-huh.
as well as I have one on also.
Okay.
And
And
so
then,
that so I'm able, to just continue, business as usual. But I'm also, I haven't started it yet, but I'm looking into your video conferencing
Mhm.
with clients, because I really never done it before, on a professional basis. So I'm looking into that, and starting that,
Uh-huh.
very soon, if this continues, to stay at home, or whatever we're going to have to do.
Right. So, so I guess kind of to close this out, because one of the things we're doing is we're also offering tips and thoughts to people as they go through these uncharted times. Any closing thoughts or things that you would want to share with somebody to encourage them to just keep going forward? Even though it's a little bit complex and nobody's exactly sure what the next thing is and all of that.
Right. Well, I mean, that alone, creates, a lot of stress.
Hmm.
And, we've heard that term, a lot of it's from the fear of the unknown, because we don't know, where we're going with this, pandemic. I mean, the experts and the medical professionals, and everybody working with the president, are trying their best to get a grip on this. But it's just, the unknown, and you have to, just be careful of your stress. I have to give a lot of credit to the parents out there, moms and dads, that are home with, children,
Hmm.
either a child or multiple children that they have, and then, having to, to homeschool them if they don't have any experience in that. I mean, that alone can bring some stress. I mean, a lot of women worked, and their children were in
Hmm.
daycare, and the fathers worked, and the same, the children were in daycare. So, I feel a lot for the parents, because
Right.
of younger children, because it's very demanding,
Yeah.
and just keeping the house in order, and manage more or less manage your household. It opens up, sometimes, new problems, and people are already, have already been like depressed or diagnosed with depression.
Right.
Unfortunately, this will lock in, I call it, maybe making, their symptoms worse. I mean, there's been a large increase of prescribing antidepressants, and just prescribing anxiety medication. Uh, they say, you're drinking alcohol is way up, using illegal drugs are way up.
Hmm.
So, everybody just has to learn ways to cope. And, and if you have any thoughts of hurting yourself or anything, please just pick up the phone and call 911. But but even people who are, let's say, are addicts,
Hmm.
I always like the phrase, before you pick up a drink, pick up a phone, or before you pick up a drug, pick up a phone, and just call somebody that is in recovery, and reach out to them, and talk with them. And as far as depression and anxiety, I mean, there are supplements out there that have been studied. Actually, a prescription antidepressant was studied side by side with a natural product, and the natural product actually outperformed the
Wow.
prescription medicine in treating depression. So there are there are things available out there. Even you're continuing to build up your immune system. You can take like I said before, the vitamin D, or take vitamin C, and zinc has also been very effective and in studies of I really can't say preventing viral infections, but it may help with some symptoms of the flu, or
Right.
I can't say the coronavirus because I don't know, but it builds the immune system, so it'll allow your body to fight off these any germs or infections that might be invading your body.
Sounds good. Well, it seems like good advice. So if people want to get in touch with you, what's the best way that they can call and get maybe some more specific information about their own particular situation?
Yes, I can be reached up, by phone. I always answer my cell phone if I'm available, and it's 321 549 or they can go to my website if they want to learn about me and about the products and the therapies I offer, and that's holistichealthcenter.us. And I have a number of offices. I'm able to meet people now in Melbourne, and also a new location that we just started with in Rockledge, and
Uh-huh.
also in Merritt Island.
That's good. Well,
Yeah.
Dr. Kevin Kilday, thank you for joining us today for Helping Seniors Updates, and really appreciate the insight and the advice, and hope people will take advantage of some of the good suggestions that you
And
have.
if I have time, just to say one more thing
Sure.
about spiritually, is on this time, if you may be alone or have some downtime at home, spend some quiet time with the Lord. Pick up your Bible and read it.
Yes.
Pray. And some of the old sayings, just live one day at a time. Let go of the past. Embrace the future. Remember what family, friends, and life is all about, and that is love. And
Good
that's
sound
it.
advice. Thank you, Dr. Kevin Kilday, for joining us on Helping Seniors Updates. And for thank you, viewer, for joining us. Want to remind you there are some terrific Helping Seniors TV shows that you'll be able to find online that we've had the privilege of doing together with Dr. Kevin Kilday about holistic health, pain relief, and addiction relief, and even cancer treatments and things that Dr. Kilday has been involved with. And two, you'll find Wednesday's radio show with Dr. Kilday also online. So you can visit helpingseniors.brevard.org, helpingseniors.brevard.org, or find us on the YouTube channel, Helping Seniors of Brevard. And in all cases, want to put one last plug in to remind you to get your Helping Seniors of Brevard car raffle tickets. The drawing is being rescheduled, but you can get your tickets now, one for 25 or five for 100. Each ticket is a one admit one for the American Muscle Car Museum the night of the grand drawing event. That's going to be a great big fun time when they release us from the extra precautions we have right now with COVID-19. We'll be back on Monday again with another Helping Seniors update. Thank you again, Dr. Kevin, for joining me. I'm Kerry Fink for Helping Seniors of Brevard.